this morning, and me, Nancy Silvertooth, and we try to make these programs informational, helpful, give helpful information. And this may get boring to some of you. I hope not, because it has to do with health insurance. And it's a timely thing because open enrollment for the Affordable Care Act, sometimes called Obamacare, sometimes called other things, but I like to refer to it as health care through the marketplace, where you have to call the marketplace or go online and get health insurance. Open enrollment expires this coming Saturday, December 15th, probably at midnight, and you need to get health insurance, see somebody about health insurance. And let me tell you right off, you probably know this, but get my list here. Hatchet Insurance sells this insurance. The agents who sell this insurance, the insurance company pays them. It costs you nothing. You just call them up and make an appointment and sit down with them, and they'll fix you up. And that is Hatchet Insurance. Miss Virginia there does it, 967-7546. And at V.R. Williams, Chris Rose, and there's another lady there also that will help you. Their number is 967-2268. And get in there. This is Thursday or Friday. They probably won't be there on Saturday. And, of course, you can always call the marketplace. But what I want to tell you is give you some information that might help, that hopefully will help you if you happen to fall outside the guidelines for people who are eligible for the insurance income-wise. As we know, it's based on the eligibility. Basically, it's based on, well, you have to be a United States citizen and some other things. But if for one person you have to have an estimated income for 2019, and that's estimated, for one person, $12,140. If you go over $48,560, you don't get the tax credits. What that is 100% to 400% federal poverty level. That's the category of folks that get the tax credits, that get help paying for their insurance. And anybody can buy insurance on the marketplace. It's eligible, but you may wind up paying the full price if you don't fall into these income guidelines. And most of the people I talk with are maybe don't make quite $12,140, or maybe disabled, not determined disabled yet, but maybe zero income. And I want to give you some hints that might help you be qualified, so that when you go in and sit down and talk with the insurance agent, or you call the marketplace, you'll be able to tell them, my estimated income for next year is, for instance, $13,000 or $15,000, and there, of course, has to be some basis for that. And you estimate it. You can estimate it at whatever you think you should, but then within 3 months they'll probably require you to send in something verifying that you're going to be some sort of written proof. It could be something signed by the employer, something signed by somebody that you mow yards for in the summertime, or cut their hair, or keep their children, something to verify the income. I'll also mention that, and I noticed in my notes that I made some time ago, now I've got to find it, that if your income is too high, if you're one person and your income is over $48,560 estimated for next year, there are actually deductions that you consider. Look at the bottom of your 1040 form, and what's mentioned is, I'm going to flip over to it right quick. I got it here, I think. But anyway, one of the items is making a contribution to your IRA, and I'm going to flip here. God, let me find it right quick. 33. So I can read it off to you, because it might help you get your income down legitimately where you'll be able to get the tax credits. Okay. What I'm getting this from a guide. Actually, anybody can look it up on the internet. It's just type in Beyond the Basics, and it's a document provided by the Center on Budget and Policy Priorities. But anyway, here's some things that you consider to get your income down within those guidelines. One is unreimbursed classroom expenses paid by teacher. Educator expenses may be deducted, but the deduction is limited to $250 per teacher per year. So if you're a teacher and I bet you've got some unreimbursed expenses you have paid, you can use that to lower your income a little bit if you need to. Of course, if you're a teacher, you're probably covered by insurance. But another is IRA contributions. A contribution to a traditional IRA, not a Roth IRA, may be deductible depending on the household income. You've got to look at IRS Publication 17 for details. Another is student loan interest. Again, you need to look at the IRS rules, certain tuition and fees, moving expenses. Beginning in 2018, moving expenses due to a change of employment or business location. It says are no longer deductible except by members of the armed forces. So look at these. Just look this up, the details in your IRS publications, or check with your tax person, your CPA, and see if there are deductions that you can legitimately use to lower that income to get it within the 400% category. Now, some income to think about that you might not think about, that when you're estimating your income for next year, of course there's obvious categories. Your job, of course, if you lucky enough to have insurance on your job, you wouldn't need to use that. But your job, temporary, occasional, small jobs for performing personal services such as child care that we talked about, mowing yards, cutting hair, anything that you can think about that you do out there, maybe just part-time or during the summer, that you can put in there to get your income, if you're one person, up to that $12,140. Now here's something that it's a little complicated, but I find that I can help people sometimes work through to get qualified. And let me flip over to my guide again here. And it has to do with, I'll just give you an example. A parent calls me and starts asking about getting the insurance, and they'll say maybe they have a disabled child, an adult disabled child who's not drawing any type of benefits, not able to work. How can they get insurance? And it could be that the parents are on Social Security or have some income, and what's available is claiming as a dependent that child who lives with them full time or otherwise qualifies as a dependent. And let me flip over to my page here so I can tell you exactly what I'm talking about. Who can be claimed? Okay, just a minute here. I didn't want to try to memorize all this. Okay, now if you have someone or know someone that is, say, an adult, child, or other relative that doesn't have insurance, it may be possible for those folks to file a tax return as a tax filing family, and that person be a dependent, a legal dependent, and get insurance. Now here's how the IRS defines children. There's two different qualifying dependents. One is who can be claimed as a qualifying child, and the other is, quote, a qualifying relative. Both of them count, but the guidelines are a little bit different. To claim a qualifying child, of course, they have to be a United States citizen, lives with the tax filer for more than half the year, are under 19 at the end of the year, or 24 if a full-time student, or any age if disabled. Now, remember, if disabled, any age, and does not provide more than half their own support. And, of course, you can find this again in IRS Publication 17, but I've run across several situations where a disabled, unemployed person may be a child, may be another relative. I had a situation one time where one sister, disabled sister, lived with another sister who was fully supporting her, and she would be able to claim her. She could file a tax return, claim her as a dependent, and the disabled, unemployed sister who had no insurance could be covered because their income together would meet the guidelines. Now, I know this is complicated. You're going to have to get into the IRS, but I just want you to think about someone who is unemployed, maybe disabled, how they can qualify for the insurance. Okay, the other category is who can be claimed as a qualifying relative. They won't fit into this category as a qualifying child. They're a U.S. citizen, receive more than 50% of their support from the tax filer, are related to the tax filer, or live in a tax filer's home all year. And their gross income is less than $4,150 in 2018. I wanted to put that out there because people don't realize sometimes that that's one way for a person to qualify for the health insurance. Because take two parents and they have a disabled child, or not disabled, just unemployed, just not no income for some reason. If those two if that child or another relative that qualifies, it wouldn't have to be a child, fits into one of these categories as a qualifying child or qualifying relative, they can file a tax return. The Affordable Care Act eligibility is based on how we file our tax returns, and they could file their tax returns and, of course, go ahead and apply for the insurance and give the information that this person would be a dependent next year. I got myself sidetracked. Say two parents, if they include this child, that would be a three-person household, and if they had combined income, even including Social Security, of at least $20,780, they would be able to get insurance for this unemployed person. And so think about that. If you just know somebody that doesn't have insurance, that is living with, I think the key usually they're living with somebody who is employed. Yeah, well, or even drawing Social Security. Yeah. Social Security is one of those incomes that count in the Affordable Care Act insurance. Yeah. And I'm rattling on here. If you have any questions, call me up as we go along. I know this is going to get boring, but I wanted so much for everybody out there to realize that Saturday is the deadline, and actually obtaining insurance, the insurance coverage is easy when you've got the income, when you can tell your insurance agent, or you call up the marketplace and you can tell them your income is, for one person, a little over $12,140. For two persons, it's going to be $16,460. And I will say this year also, I was disappointed to see that Blue Cross Blue Shield is offering their good plan of $20 deductible and I believe $675 out-of-pocket maximum coverage, but it's not zero premium anymore. It's cost, well, for a person I think 55 years old, it's about $75 a month. And then there's another company, and y'all have seen this, and maybe some of you have taken it, called Ambetter, that is now providing insurance in our district. And our district is comprised of counties east of us. We're in what's called the Southeastern District, the way the state divided us up for insurance purposes. And most frustrating to me when I checked on insurance for someone that lived in Coffee County, they still have the Blue Cross Blue Shield zero premium plan. I suspect it has to do with Blue Cross Blue Shield is the only provider in that district, whereas we now have Blue Cross Blue Shield and the Ambetter company. And just check if you the Ambetter premiums, they do provide some lower premium policies, but you need to check with your providers, with your doctors that you go to, and see if they're accepting the Ambetter. It's new to me. I think it's new to most people around here. Betty?
Well,
I check my notes here and see what I'm leaving out.
I just want to tell the people how much time you have spent researching the insurance and how much help. I mean, she has not been paid 1 cent for researching all of that for you. Please understand that you may call her today while she's on the radio and ask questions. It is complicated, but Nancy has been to every workshop, and she has conference calls weekly, I guess, or very often she has conference calls to keep her up to date on the kind of thing that will help you. She's doing this for you. Nancy has insurance. I have insurance, but I feel for those of you who don't, and so does she, and she has spent all this time researching to help you with your insurance. So please call her here, or she will also give you her cell phone number. I know because she's helped so many people. I have referred so many people to her. And one thing I'd like to say off the insurance thing, on January the 12th, I'm still on the State Democratic Executive Committee, and I represent 7 counties. And we will have an election on January the 12th to elect a state chair. Mary Mancini is the incumbent. She has been our chair for 2 terms, I guess, and she is seeking another term. A young lady named Holly McCall from Franklin is also running for that office. She is opposing Mary Mancini. So I need some input from Democrats in 7 counties to tell me how they want me to vote. I don't go just vote the way I want to vote. I contact every chair in all 7 counties, and I give them, I already have a bio on Holly. I don't have one yet on Mary, but I've been in contact with Mary. I talked with her yesterday. But I do want to get input from people in Franklin County who are interested in this election and tell me how to vote. And last night I talked an hour and a half to somebody in Coffee County telling me how to vote. So it will be a heated election, and I have to decide, or you have to tell me how to vote, and I'll be interested for input from any of you about the voting. Of course, Franklin has really come to the front in this election. I noticed again this in, I guess, yesterday's paper. The safety commissioner is going to be from Franklin. The education commissioner is going to be from Franklin. And the caucus chair is from Franklin. And the Speaker of the House is from Franklin. And our governor's from Franklin. So Williamson County has hit the spotlight. And then this girl, who is a Democrat, is running for the state chair from Franklin. So Nancy, what else did you have to add?
Well, first of all, thank you for your kind words. For some reason, I just love learning about all I can about this insurance and try to keep up with it, and just I hate to see people go uninsured that might be eligible, but that might be somehow with a little creativity, legitimate creativity, be eligible for insurance. It just can make all the difference in the world, and I just, for some reason, I just love doing it. And I'll mention that you know, when we go vote, we'll see maybe way down at the end of the ballot, state Democratic committee woman, and if you're a Republican, you'll see it on the Republican ballot, state Republican committee woman. These offices are state. They were set out by the legislature years ago, and they actually do things. We don't realize it. We don't. If somebody asked what does a state committee woman do, we probably couldn't tell. But Betty goes to meetings. As she says now, she's going to be in a spot to try to decide who to vote for as far as our state Democratic Party chair. And
it doesn't pay anything.
Right. Exactly.
It's at my expense, I'll tell you.
Betty has done this for, gosh, about 16 years or more. She's done it for years. She's still, she every now and then she'll ask me, Nancy, you want to go to Nashville with me? I got to go to a committee meeting, you know. And she's very active, and I just appreciate, and I know y'all do, what Betty does. And one thing, looking through my notes here, that I do want to tell you. In fact, I was talking to somebody just this week who was going to be helping get signed up for insurance starting January the 1st, and he's got health problems now to deal with. And I want to tell you about Grundy County Primary Care Center. Over the country, over the United States, there are federally funded, they call them federally qualified health centers in places where the federal government decided that they're really needed. And in Colmont, Tennessee, we have one. And they are a full-fledged primary care center. You go there and you get treated, and you have to pay only based on your income. If you have no income, you're not going to have to pay anything. And grab your pen and write this number down if you know somebody that's needing medical care now and can't get it. 931-779-4002. 931-779-4002. Our next closest one is in New Market, Alabama. It's in Alabama, but it's one of these federally funded health care centers. And on your little cell phone or on your computer, you can just look them up. Just type in federally qualified health centers, and they'll pop up. Of course, as you know, you usually put in your zip code, and it'll pop up the one closest to you.
And I'm sure these are walk-in situations.
Well, probably, but I would call them before I headed out to Colmont. I guess I'd call and make an appointment. Yeah, New Market, yes. And of course, you know, we're so thankful for our local volunteers in medicine that Dr. Thomas Smith started up years ago, and he's still involved, and others, and those folks those medical providers who come there do so, giving their own time, absolutely free of charge. And you can get, it's sort of limited medical care there, but Dr. Smith said to me one time, and I remember this. He said, maybe I can keep somebody from having a stroke out there, you know, by dealing with blood pressure. I think blood pressure, diabetes, the things that so many of us have to have treatment for and don't have insurance. And of course, volunteers in medicine. I don't have the number before me, but it's of course out on the boulevard in the county building. In Tullahoma, we have Partners in Health. I think they require somebody to be employed to take care of them. But anyway, that's Tullahoma.
And if you're not high maintenance now, you will be.
Oh yes,
most likely you will be.
Yes.
When I took insurance, I didn't need it. I didn't ever go to the doctor when I took it. My husband had me insured at Arnold Center, but when the opportunity came for the teachers to take insurance, in order to have enough teachers to get it, I took insurance when I didn't even need it. But thank goodness I did, because I do go to the doctor now. I am high maintenance, I'll tell you, and if it hasn't hit you yet,
it will.
Probably will,
right.
Unless you are an exception.
Yeah.
Got a phone call here.
Okie doke.
Do you want to hit this first button?
Yeah, what's flashing.
Hello, good morning.
Hello, Miss Silvertooth. Since this show is called Common Sense Matters, I wonder if you all are able to speak to why that our state is not accepting the money for the new insurance the last 3 or 4 years, whatever it's been. I'm not sure how many.
The Medicaid
years.
expansion.
Yeah.
Medicaid expansion, yes.
There's
wonder if you're able to speak to that.
No, there's no common sense answer to that. We ought to be taking. The answer we keep hearing is, we don't. One thing is, we don't know what might happen later on. Well, of course, that occurs to everything in this world.
Right.
But there is no. I cannot find any common sense answer for our not taking Medicaid, doing Medicaid expansion.
Well, could you maybe tell our listeners what they might be able to do to get out of the way of my radio here. I'm messing up so you can't hear me. What the listeners could do as far as calling our new legislatures.
That would be a thing to do, is call up. So I read just this morning, of course, again the article that it started out saying 3 deep red states just have expanded Medicaid. Why not Tennessee? And supposedly 63, not supposedly, it's a published fact, 63% of our folks out there, our voters hopefully, are for expansion of Medicaid. So contacting legislators, and especially maybe the new ones, would be the thing to do.
There's one Republican legislator.
I'll hang up and let y'all discuss that, if you will.
But thank you. That's a very and of course every time I talk with someone that does not have insurance and just cannot qualify, no matter how hard we try, for the Affordable Care Act, it just breaks my heart that we could so easily take care of everybody, and there are even veterans families out there uninsured because they don't fit into a category that they need to for the VA insurance, and it is so hurtful and costs everybody not only money but the pain and suffering people go through that wake up in the middle of the night sick or hurting and have no choice but to go to the emergency room.
And our tax dollar went to other states. Other states are thrilled that we didn't expand Medicaid because they got our money.
And I believe Kentucky is one of them.
And Kentucky has done fine with it.
And I'm gonna hang up and let y'all.
Okay.
Thanks
so
for
much calling, but that
go.
Okay, thank
but
you.
This new administration has already said.
The very bottom.
this new administration has already said, well, that they're afraid that if they expand Medicaid, that the government will not continue it, and they'll drop us, and we'll have to pick it up. So what? Look how many people's lives could be saved during the time that we are getting help from the federal government. You know?
Right.
I don't understand why we can't save lives.
And you can't govern by being afraid. Somehow it comes, I think of this so much, Mr. Joe Bean used to say, a faint heart never won a fair lady. If you go around afraid to do this and afraid to do that and doubting this and doubting that, especially as a leader, someone who should lead and make decisions, you're not going to be much of a leader.
No. And I don't understand. I've never understood, and I have written letters and talked to legislators and everything else about expanding Medicaid, and went to a listening meeting of our senator to see, and she said that the question I asked was, is there any way that the bill could have been worded so that you would have voted for it? And so she talked about something else and changed the subject, and I said, and so I asked it 3 times before she answered, and then she said, no, there's no way that it could have been worded that I would have voted for the bill. And she is, our senator, Janice Bowen, is one of the ones who kept it from even coming to the floor to be voted on. The House did not even get to vote on it. So, you know, I'm just really upset. Like I say, I have insurance, but I feel so sorry for those people who do not have it, and I'm willing to pay a little bit more on mine, and that's what I did when I enrolled as a teacher. I didn't need the insurance, but I took it in order for the teachers to be able to get it. We had to have a certain number. Another phone call.
Hello.
Hey.
Hey.
Can I talk with the ladies on the radio?
Yes, you're on the air.
Oh, hey. Hi. Thanks for doing these shows about healthcare all the time. It's very informative. I think that Medicaid is going to be expanded in Tennessee because the legislature and a lot of people that vote for them don't want anybody that maybe isn't working or can't work or they perceive to be taking advantage of the system. They don't want them to have anything. They think everybody should just go to work and they'll feel better. Now, I did a lot of canvassing for this election in November, and people were interested in health care. But then Bill Lee said that he was going to fix it all, and they believed him. He's got no plan. He thinks everything is wrong with our medical care delivery system, and he's going to take 10 or 15 years to fix it. What I want to know, and it's a rhetorical question because I know you can't answer it, but why are people in Tennessee so mean? What happened that they have such mistrust for anyone that's struggling? Maybe other callers will be able to answer that, but everybody has a story about somebody they think they're taking, about someone that they think is taking advantage of the system.
Well, and of course, we know that just about anything good out there that comes along, somebody, being human, will find a way to abuse it, and
right.
those situations should not keep people from acting in the best interest of everybody as a whole. And I guess I'm kind of crazy, but I'm hung up on, because I was in public office, I respected the law, I tried my best to do what I was supposed to do. They take an oath, General Assembly people take an oath, and included in that oath, it says that I will not propose to assent to any bill, vote, or resolution which shall appear to me injurious to the people. Or
that's oath.
And they just ignore that. I would read that and take that seriously, and somebody took me on about doing something for poor people. I think that's our basic. If we go by the teachings of Jesus at all, that's our basic responsibility and basic beliefs is ministering to those who can't help themselves. What higher calling could you have than that? But my goodness, to say, oh, people are lazy and won't work and they don't deserve this and don't deserve that, that just to me is a negative, unnecessary attitude.
Well, I think the previous caller was asking about that. I'm not sure how she voted, but I would advise, ask you to advise your listeners that if they have a health problem, they can't have access or find a hospital or a doctor, they need to call their state senator and legislator, and your listening audience is in Franklin, so that'd be Janice Bowling, and then Iris Rudder when she gets sworn in, and Bill Lee. Call them up, write them a letter. I need help. What are you going to do about it?
There's one Republican legislator from Davidson County who is for Medicaid expansion. Now, I don't know how far he's going to get, but he has come out for Medicaid expansion. The only Republican down there who's expressed any desire to expand it.
Well, and you know that you mentioned something, our caller mentioned something that sticks in my mind also. People who have insurance and who could drive anywhere to obtain medical care, who are people of quote means, I would think they would not want to live somewhere in a community without a hospital. And you would think a phone call from somebody like that saying, look, I have insurance, but I want my community to have a hospital. And they keep closing. They keep
14.
They keep on. It keeps on.
We have lost more hospitals than any other state except Texas. And, of course, Texas is a lot bigger than us.
Yeah.
But percentage-wise, we've lost more hospitals than anybody.
Well, keep up the good work, ladies. Thank you.
Thank you, caller.
You know, and one thing the speaker thing. One thing I meant to mention, too, which is off this, we had a potluck supper Monday night at a home in County, and I can't remember the woman's name because of my age.
Gina.
But she lived, what was her name?
I believe Gina.
Gina.
Yeah.
She lived on Hines Street, and we just had such a good time, and several husbands came to our meeting, and we just had, actually we didn't have a formal meeting, but we had a social, and the food was just outstanding. Some of the best food I've had in a long time. I make a green bean casserole, but Carol had made a green bean casserole that was much better than mine, and I told her to be sure and send me the recipe. But the food was just outstanding, and we had just a real nice social.
Yeah, I missed that when I was babysitting great grandchild.
That happens too.
Yeah. Something I meant to mention to you when you're looking at insurance plans, it's very confusing, and I don't don't claim to be an expert on interpreting the insurance plans, but this is something when you're looking at plans that I look at, and that is the out-of-pocket maximum. Of course, there's always a deductible. We look at the amount of the premium. Then we look, and bear in mind, whatever premium you sign up to pay, you're stuck with that. You're going to be paying that. But there are different deductibles, different out-of-pocket maximums. And that out-of-pocket maximum is important to me because that means when you pay, for instance, if it happens to be $600, $675, something like that, that's a low one, of course. When you pay that much in deductibles and co-pays, then the insurance company, that's your out-of-pocket maximum, and the insurance company is going to pay 100% of everything else. So look at that out-of-pocket maximum, and a lot of us, a lot of people, say just middle-income people, could handle even $2,500, $5,000 maybe, to have to pay. We might have to pay it off for the month or something, but these hospital bills, $10,000, $15,000, $20,000, $50,000, those would be disastrous for individuals.
I spent one night in St. Thomas, and it was $25,000.
Yeah, and so that's one item that I wanted to remind you, and when you look at these plans, it'll have maybe the deductible, say $20, and then there's the Blue Cross Blue Shield SO4S plan, then says it pays 50% of your co-pays and whatever after your deductible, up to that out-of-pocket maximum. But when you reach that out-of-pocket maximum, you're basically home free.
Yeah, then you don't pay any more for the rest of the year.
And so look at that, as well as remembering the premium itself, whatever you agree to pay. To me, I would sort of be leery of paying a real high premium to get, say, lower deductible or lower out-of-pocket maximum, unless it was really worth it. You just have to weigh the situation, because you're stuck with that. If you sign up for a high premium, you're stuck with that high premium. You're going to be paying that every month, regardless. Let's see, Al, are we getting? We're getting towards
10 minutes.
10 minutes.
10 minutes.
10.
Oh, 10. All right, let me look at my book here to see what else.
We also talked about a fundraiser when you weren't there, Nancy. We're going to have a rummage sale, I think, this spring. Also, they were talking about getting an entertainer, and I don't need to reveal who that is, but a famous entertainer to come for a fundraiser also. Even though we don't have an election right now, we need money for the next one. And please give me any input that you have on this chair for the state party. 2 women are running. Of course, it could easily be a man, and it has been in years past, but this time it's Holly McCall and Mary Mancini. And Holly's from Franklin and Mary's from Nashville.
I would remind you that of the different ways that you can get the insurance. An easy way is right there in your living room. Get on your cell phone and call the marketplace.
And December 15th now is the deadline.
Yeah, that's it. After December 15th. And I mentioned this. If you wind up waiting to the last minute to call, sometimes if you call that last day, and of course they're usually that last day or so, you'll get a recording saying, "We'll call you. We've got a record of your call. We'll call you back." So if you do wait to the last minute, go ahead and call, because they usually will call you back then and let you sign up. You run a risk though if you sign up like the next day or the next day after that. You might not get the insurance by January the 1st. There's a general rule that when you sign up for one of the policies, by the 15th of the month, it's effective the 1st of the next month. If it's after the 15th, you might not get it till February the 1st. So don't wait to the last minute, and just be prepared. You can go online, just put in your little cell phone, federal poverty limits, and look for one of those charts. A bunch of them will come up. That'll give you the or put in ACA poverty limits, or PTC, premium tax credits, and you'll get one of these tables that I'm talking about that tells you where you need to be in order at what level you need to be at for your family, whether you're a family of 1 or 2 or 3 or 4. And by the way, don't forget, children. Many children out there are eligible for TennCare or Cover Kids. The federal program, by the way, is CHIP, called CHIP, Children's Insurance Program. Hillary Clinton, actually, back when Bill Clinton was president, when she tried to get insurance passed, she didn't make it, but she did get the Children's Insurance Program, and that's a federal program that's still in force. Many children are insured because of CHIP, because it goes on. What it does is it goes beyond, when parents are beyond the level of TennCare, for a child to be on TennCare, they can go on CHIP, or Cover Kids in Tennessee. We got 5 minutes to talk. Don't y'all have any questions out there?
One thing that I'm disturbed about, too, is public education. This administration is already peddling vouchers in charter schools.
Yeah, I noticed that, yeah.
And I'm nervous about public education and what's going to happen to it. The new commissioner of education, I think, is from Franklin, and I don't remember who it was, but you need to really pay attention to what's happening to education. I don't know what we would do without public education. We got to have public education, but when you take money from the public schools to support private and charter schools, it's going to ruin public education.
And of course, Franklin isn't that Williamson County? Isn't that the most wealthy county in the state?
Yeah, it is.
And it won't matter. A voucher system would probably work for them.
Yeah.
But Williamson County, Franklin, Tennessee, is a whole lot different from Franklin County and Grundy County and Coffee County, and but that's a good idea, Betty. I know what I wanted to do. My phone number, my cell number is 308-7150. That's 308-7150. Call me, and if I don't answer, I may be at work. Just leave me a message if you have an insurance question, and I'll call you back.
And she will. I have referred so many people to her, and she's helped so many people who I found out just by accident who did not have insurance. So please do that. It seems to me that Nancy's more interested in some of you having insurance than you are yourselves. Please take advantage of the fact that she has so much knowledge about it, and she can help you. I went to the very first meeting that we had in Tullahoma, but I didn't have the time to spend on the rest of it. But Nancy has taken the time and made the time to learn all there is to learn about it, and she can certainly help you. So don't forget that.
And I will certainly try. Something else popped in my mind and it left me.
And we don't meet Saturday.
Oh, we don't meet Saturday.
I don't think we're meeting in December.
Okay.
The party. Now, the women met, but the party. And the women will meet again January 29th. That's not our regular meeting time, but that's the fourth Tuesday because that was the time that we could get together because we got to elect officers.
Right.
So that will happen on January 29th.
Oh, I know an insurance thing I wanted to mention. I will see people will call me and they say, I called the marketplace and they said it would cost me $800 to get insured, get an insurance policy. And of course, what has happened in that situation, they've given the marketplace or put into the computer an income that's not within the guidelines of either at least 100% or less than 40%, and of course the quote computer system says, nope, you don't qualify, you don't have to pay the whole price. And the key is either calling or putting into the computer an estimated income. It's estimated income for 2019 that falls within those guidelines.
And it's Common Sense Matters, and this is a common sense thing that we're trying to get you to take advantage of. Don't forget that, and we would love to have you join us at any meeting, and please let us help you with this insurance situation.
Right. We do deal with common sense, everyday matters, and everyday common sense people. Everybody's welcome in our Democratic Party meetings and in our Democratic Party.
All right, so your marketplace insurance deadline is this Saturday.
This Saturday, right.
You can go to an insurance agency that does this, or you can go online.
Yeah.
Exactly right.
And now, Hatchett, you say, does it, and who else?
And V.R. Williams.
And V.R. Williams. So, any of those people would be glad to help you, and of course, don't forget that Nancy also can advise you, because she has really done a lot of research on it.
So those two locations, today and tomorrow, is the last chance there. Online, you can go through midnight Saturday online to take care of it.
Right.
So please.
And don't forget the toy drive. I know that I had some late books at the library, so you can take a toy to the library and have your fine erased.
Get forgiveness.
My grandchildren read, and I'm glad to pay fines so that they'll read. I don't care if they are late, that's fine. But yesterday I took a toy, and so I killed two birds with one stone.
There you
and I
go.
didn't have to pay a fine.
There you go. All right, ladies, thanks for coming out. You're listening to WCDT AM 1340, W295 AV FM 106.9 in Winchester, Tennessee.